The Dallas lab worker who spent part of a Caribbean cruise in isolation has tested negative for the Ebola virus. Monday, health officials expect dozens of people on a watch list to be given the all clear after 21 days of monitoring. But the concerns are far from over. There are new calls in Europe to help fight the Ebola outbreak at its source. CCTV's Jessica Stone is joining us live from our D.C. newsroom. And Jessica, the U.S. president appears to be doubling down on his coordination of the response.
He does indeed, Susan. In fact, U.S. President Barack Obama has been holding meetings almost daily, really, since he canceled some campaign fundraisers last week to focus attention in the United States on the Ebola response. For example, Saturday night, the White House reviewed the way the United States is tracing Ebola contacts. In addition, the Pentagon is now putting together teams of medical responders to deploy if there's an outbreak in the U.S. With European Union officials set to meet Monday, Germany's foreign minister suggested the EU could send a team of medical and logistical experts to West Africa to combat the Ebola outbreak.
The magnitude of the Ebola crisis calls for a comprehensive approach, encompassing all the instruments of our common foreign and security policy.
The chief of the United Nations Ebola response said Sunday the world wasn't prepared. UN, governments, populations, and now we're catching up. Over the weekend, the World Health Organization said it would compile its own report on the global reaction in West Africa after coming under criticism for a slow response to the rapid spread of the disease there. Only now, nearly a month into the outbreak in the United States, is the U.S. military preparing a 30-member medical rapid response team. The U.S. Centers for Disease Control is also revising its guidance for personal protective gear to include covering all exposed skin. At least 2 Texas nurses contracted the disease while caring for Ebola patient Thomas Duncan, despite wearing protective gear. And a lab supervisor at the same Texas hospital which cared for Duncan spent her Caribbean cruise in quarantine, worrying passengers, only to arrive back at a Galveston port Sunday to some encouraging news. She has tested negative for Ebola.
So today she enters day 20 of her since she's been contacted in the laboratory, and so there's nothing special that we need to do.
In Sunday morning's local Dallas newspaper, the CEO of Texas Health Resources wrote a community letter saying all CDC Ebola protection procedures were followed at the hospital and apologized for not diagnosing Duncan's Ebola quickly enough. Quote, "We did not live up to the high standards that are the heart of our hospital's history, mission, and commitment." And Thomas Duncan's fiancée and family members who were living with him while he suffered from Ebola will finish their quarantine Sunday. So far, they are still not showing any symptoms, Susan.
Jessica, what are we learning about other nations adding to their Ebola response?
Well, in addition to those remarks from the German foreign minister, we understand that the Brussels airport has begun screening for passengers that come from West Africa through that airport, and that Israel's airport has now updated its screening procedure to include any passenger from the entire continent of Africa. Susan?
Jessica Stone reporting live in the newsroom. Thank you for that.